Hello there, my friends. I have what I hope is going to be a treat for you today. I actually put together a fairly comprehensive case study. I want you to really see what I find in chronically ill patients. They may have a diagnosis of fibromyalgia. They may have a diagnosis of chronic fatigue syndrome, autoimmune diseases, or they may have no diagnosis at all, simply struggling with health issues. So if you'll hang on one moment, I'm going to share that with you.
Dr. Mark Dailey is president and CEO of Birmingham Functional Medicine, founder of Fibromyalgia University, a certified functional medicine practitioner, and a nutritional counselor with advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and thyroid function. With over 25 years in clinical practice, he focuses on chronic conditions like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, as well as autoimmune conditions. Let me introduce Dr. Mark Dailey.
Okay, guys, let's get right into this. I'm Dr. Mark Dailey with Birmingham Functional Medicine. I'm going to review a case study with you. We're looking at a 25-year-old woman. Her history revealed hypothyroidism, elliptocytosis, which is an irregular shaped red blood cell. She struggles with fatigue, shortness of breath, yellow skin and eyes, mold exposure, and swollen lymph glands. After doing an extensive case history that took probably 45 minutes, we looked at her family history. We considered her youth. Did she have any chronic conditions as a child, gastrointestinal issues? Did she take a lot of antibiotics as a kid? So, and also travel history, because her parents were missionaries, and actually even at the time of this study, they are in Africa. So after considering all of those things, spending a considerable amount of time digging into her case history, we decided to do the following advanced laboratory tests. So we did environmental toxins through her urine, organic acid test through her urine. We did a mold test through her urine. We looked for heavy metals using her hair. We looked at food sensitivities using a simple blood spot analysis. So she actually pricked her finger, put a few drops of blood on a panel, and then sent it into the lab. We also did a comprehensive stool analysis. Hippocrates was a pretty sharp fellow. He was known as the father of modern medicine, and he said all disease begins in the gut. And I don't think he was far from the truth. So we definitely want to find out what's living in her gastrointestinal system. So all of these tests and test kits were actually sent to her home. She performed these tests at home, sent them directly to the lab in the containers that they sent her, and then they reported back to us. And I'm going to review those findings. Now, what I really want you to consider is yourself, in kind of put yourself in this situation. These are tests that your doctor has no doubt never run. And I'm not belittling your doctor nor belittling the tests that he did. Those are probably, or she did, those are probably important tests. What I am saying is that these are outside the box for people that struggle with a chronic health issue. And unfortunately, most medical doctors don't have the time required to do an in-depth history and actually run through these advanced tests. So let's go ahead and take a look at our findings. So the heavy metal test actually yielded very little information. But I put it in here because I want you to see some of the things we look for. So we're looking for high levels of mercury, nickel, aluminum. All of these things can be detrimental if the line is up into the higher percentages. So nothing there, but in many people we do find heavy metal toxicity. Here we looked for mold. Now, we knew that she had been exposed to mold as a child. She had been in several homes that had mold. And actually, you can't see this very well. Let me see if I can move myself a bit. And here you'll see, yes, we found Aspergillus mold. And that's a problem. We also found multiple species of mold. So she is trying to detoxify. So again, she's trying to detoxify, but for some reason, her detoxification pathway is not able to keep up with the amount of toxic exposure. So we have to, if we move on into the treatment phase, we have to make sure that the mold exposure has ended, and then through diet and pharmaceutical grade supplements, we have to open up these detoxification pathways and allow her body to lower these level of toxins. Her body will need time and the proper support to accomplish this. So we found mold. This is a problem. Symptoms of mold exposure could be as simple as runny nose or stuffy nose. Do you have a nose that runs continually or every time you eat? That's a problem. Eye irritation, sore throat, dry cough or sneezing, skin irritation, rash, scaling, wheezing, shortness of breath, malaise, or brain fog. Now, how many people are suffering with those problems? I mean, most chronic conditions that I see share several symptoms. One of them is brain fog, chronic fatigue, pain, and gastrointestinal distress. Moving on, this is the environmental toxin test. And I don't know what device you're looking at this on, but look at this. This black line indicates extreme exposure. I'll read it to you because you probably can't see it. It says gasoline additives. This is what it indicates. Gasoline additives are used to improve octane ratings. Exposure to these compounds is most likely due to groundwater contamination, inhalation, or skin exposure to gasoline or its vapors. Oh, let me go to this one here. You see it's above the 75 percentile. And again, we have many bath and beauty products, cosmetics, perfumes, oral pharmaceuticals, insect repellents, adhesive inks, and varnishes. That's where this problem comes from. So we have to ask ourselves, does this precious woman, is she just exposed to a tremendous amount of toxins and can't keep up with the detoxification process? Or is there a problem with her detoxification? So these are things that we have to consider as we look at the results. This is still the environmental toxins, and here she has another toxin that is way high. And this is organophosphates, one of the most common toxic groups of substances in the world, primarily found in pesticide formulations. This leads to overstimulation of the nerve cells, causing sweating, salivation, diarrhea, abnormal behavior, including aggression and depression. That's another symptom I see very commonly is depression. And is there any wonder why when you're suffering from a chronic condition? Next slide is going to be symptoms of environmental toxic exposure. So toxicity in these systems can lead to immune dysfunction, autoimmunity, which is autoimmune diseases like Hashimoto's thyroiditis, lupus, scleroderma, MS, the list goes on and on, rheumatoid arthritis, asthma, allergies, cancers, cognitive deficits, mood changes, neurological illnesses, changes in libido, reproductive dysfunction, and glucose dysregulation. Guys, these are big. We're talking about one little woman dealing with this level of toxicity. Now, we're looking at the food sensitivity test, which we did. This is one that we did with the blood spot analysis. And what we're really looking for is excessive lines past the green into the yellow and, of course, even into the pink. So here, she didn't recognize it, she didn't realize it, but she had a food sensitivity to egg whites. I'm just pointing out the ones that are higher, and also green tea. Now, usually when I see these, the dairy and the grains are off the charts. I did not include that because they weren't really high in this particular case study. And again, I'm actually not going through each of these completely with you because I don't want to take up the time to do that. Each of these tests are more extensive than I'm showing you. I'm simply isolating the areas that are potential issues. Okay, so we've made it through here. The green tea we talked about. Now, what are common symptoms of food sensitivities? Nausea, stomach pain, gas, cramps, bloating, vomiting, diarrhea, heartburn, headaches, irritability, or nervousness. This particular test also looks at Candida sensitivity or yeast overgrowth. And here we see that there is some significant growth. So Candida is a fungal overgrowth. So this gal not only has mold toxicity, environmental toxins, but she's got Candida albicans, which is a fungal overgrowth. The problem with it being out of control is that its byproduct is toxic, and this is adding to her toxic load. Symptoms of yeast overgrowth could be oral thrush, tiredness and fatigue, recurring genital or urinary tract infections, digestive issues, sinus infections, skin and nail fungal infections, or joint pain. Now we're moving on to the organic acid test. So this is done with urine, but what we're looking at is the byproducts of certain dysfunctions. And here again, you'll see a highlighted area in blue, and then the other highlighted areas are what high indicators would be pointing to. So again, we have a confirmation, looking at her urine, not her blood, of yeast issues. So we're confirming that by looking at the urine now. Here we're looking at high oxalates. We're looking at mitochondrial dysfunction right here. So the mitochondria are the powerhouse of every cell. If there's a dysfunction there, it could lead to fatigue and other physiological issues. So the main symptoms of mitochondrial myopathy are muscle fatigue, weakness, and exercise intolerance. So that gives you an idea. And then still we're looking at the organic acid test. This highlights neurotransmitter issues, this one in particular, insinuating dopamine deficiencies. Symptoms of dopamine deficiencies are lack of motivation and drive. You're tired, you can't concentrate, you're moody or anxious, you don't feel pleasure from previously enjoyable experiences, you're depressed, you feel hopeless, you have a low sex drive. So probably some of you watching this video are raising your hands and saying, yes, that sounds like me. I'm actually coming to the end of this, and I'm afraid I'm going to run out of time here. This looks for nutritional deficiencies. We see a vitamin B2 deficiency. We see high oxalates, which is a byproduct of mold and Candida, all of which this poor gal has. A nutritional deficiency, again, the B2. B2 can lead to fatigue, swollen throat, blurred vision, depression. It can affect skin by causing cracks, itching, dermatitis around the mouth. So it's obviously problematic. Okay, so here we're looking at indicators of detoxification. Now, you know from what we've already seen that detoxification is extremely important for this particular patient. They've got fungal overgrowth, which produces toxicity. They've got environmental toxins and also mold toxicity. And what we're looking at is indicators of detoxification. And glutathione is like the mother antioxidant. So it's very, very important. So we're seeing indicators here. And you'll notice the dot here correlates to this. High values may indicate methylation defects and or toxic exposure. So we know there's toxic exposure because of the other tests that we've taken. And then the single star, if you will, is a high value for this, may indicate glutathione deficiencies. So maybe this is why toxins are building up, is because the pathway of detoxification is clogged, if you will. And of course, clogged is not a medical term. So glutathione is the master antioxidant in all tissues. Its central role in the control of many processes such as detoxification, protein folding, antiviral defense, and immune response. And the immune system plays a vital role in all of this. And where is it housed, or the bulk housed? In the gastrointestinal system. Very, very important. Signs of low glutathione might be frequent infections, difficulty managing weight, allergies, and chronic fatigue. What is it that we see associated with much of this? Chronic fatigue. So is there any wonder why someone with all these things going on can't hardly function to get through the day? The frustration I know you feel is incredible. I know you most likely feel misunderstood because no one knows what's going on below the surface if they haven't done the proper testing. All right, here we're looking at the comprehensive stool analysis. What I want you to recognize is that these are expected or beneficial bacteria. Guys, bacteria and good bacteria is vital for good health. And two of the most important good bacteria, Bifidobacterium and Lactobacillus, are way below the appropriate levels. This is commensal. These are neither good or bad. And then here is dysbiotic flora, which is bad bacteria. So really, we're not seeing bad bacteria. What we are seeing, however, is not enough good bacteria. And they may be being killed, or they being low may be the open door to the yeast overgrowth. Now, again, remember with the yeast, I'm sorry guys, I just skipped ahead. You can't necessarily see this on this slide here, but this, they found dysbiotic flora. Let me see if I could open this up a hair. I don't know that I can right now. But here they found Candida overgrowth. So we found Candida in the stool. We found Candida response in the blood. And we found indicators of Candida growth in the urine. So we're getting a really good picture at what's going on with this precious woman's health. I will admit that there was not a lot that I got out of this comprehensive stool. There was enough, mind you, but it also looks for parasites. It looks for pathogenic bacteria. It looks for worms. So there's a lot of different things that we look for here. Let me move on to the next slide, which is the role of good bacteria. I just simply wanted to highlight for you. Lactobacillus is a type of probiotic or good bacteria found in the human gut, mouth, vagina, and also certain foods. Good bacteria such as lactobacillus can help break down food, absorb nutrients, fight off bad organisms that might cause disease. And then this Bifidobacterium, these beneficial bacteria digest dietary fiber, help prevent infection, and produce vitamins and other important chemicals. So are you getting a picture of this? Now, the cool thing about this laboratory testing is that they actually will test both pharmaceutical drugs and pharmaceutical grade supplements against the fungal overgrowth. So we know for sure that in her case, grapefruit seed extract kills the Candida, the particular strain. Caprylic acid also. Now, if we were going to go the drug route, nystatin also can kill it. So very cool. It shows us how to move forward with our treatment protocols. All right, and then moving on, let's go ahead and just do a brief clinical overview. I don't know what you would look like if this was you, but it sure would be interesting, wouldn't it, to find out what's going on inside you? Well, in her case, we found mold toxicity, environmental toxicity, Candida overgrowth, which is a fungal overgrowth that produces its own toxicity. We found that bacterial dysbiosis, which is a disproportional amount of bad bacteria, or disproportional amount of good bacteria to bad bacteria. We also found a B2 deficiency. We found mitochondrial dysfunction. You know what I don't have on here? We also found a neurotransmitter imbalance because she was low on her dopamine. We found a glutathione deficiency and a food sensitivity. This is one little lady struggling to function just to get through the day. And is there any wonder why? So where do we go from here? Good question. We've now uncovered the underlying causes of her symptoms. Treatment is now a whole lot easier now that we know what the target of treatment is. So, treatment protocol. First of all, we have to remove the patient from toxic exposure. We have to make sure there's no mold in their home. We have to educate them how to get away from these environmental toxins. Whether it's the way you clean your food, the way you cook your food, the cosmetics that you're using, or the mold that's in your shower, or worse yet, behind the walls. We have to remove the foods that she's sensitive to, because that causes an immune system activation, which leads to a flare-up. We have to starve and kill the Candida, which is the fungal overgrowth. We have protocols that we've used successfully for 15 years. We need to add probiotics, add the vitamin B2. Then we need to open up these detoxification pathways. And as you can probably guess, this is vital for her. We've got to open them up. We do this through lifestyle, pharmaceutical grade supplements, and education. We have some really unique ways to help with this. And in her case, it is vital, potentially the key. Then we go back in. Once we feel like we've accomplished these things, we heal and seal the gut lining, and then we reintroduce one at a time nutrient-dense foods to build a diet for life. So from the start of our patient relationship, it's taken about 30 days to get this far. In other words, to get to the place where we've sent her the test kits, we've had the tests done in her home, sent them to the lab. The lab has had time to evaluate, culture, and give us the findings. About 30 days from the start of our relationship, from our history, moving forward. Now we're able to create a therapeutic diet and prescribe the proper supplements to aid in the patient's recovery. And this step normally takes another 30 to 45 days, depending on the severity and the patient. Once the bad guys are in control and the detoxification pathway is running smoothly, we can now go back in and heal the damage that's been done to the lining of her gut. I refer to this as the heal and seal part of our protocol, and this takes an additional 21 days. So you can see, guys, this is a process. It doesn't happen overnight, but you didn't get sick overnight. And you can take drugs, you can go the medical route, but they're not going to discover any of this. Then we start to add back nutrient-dense foods one at a time to build a big, beautiful diet for life, something that will sustain health. So we provide certain tools in our functional medicine program. We have an awesome video course that walks you through each step of the protocol. We have a telephone application that you download, and it's got your exact therapeutic diet on it, foods to eat, foods to avoid, shopping list, recipes, and tracking capabilities. You can track your water consumption, bowel movements, your exercise activity. You don't have to, but you have that option. And we provide 7-day-a-week email and text support. We also have weekly consultations, so you're not left by yourself. I normally talk to each patient once a week for about 15 minutes just to answer any questions and to evaluate certain criteria. You're never alone in this program. You never have to worry what the next step is. You have a coach and you have a guide. We guide you every step of the way. I like to say, not only will I be your coach, I'll also be your biggest cheerleader. I want to help you recover from this condition, get your life back, and reach your destiny. Now, if I can be of any help, my clinic name is Birmingham Functional Medicine. I work with people all over the world, literally. All of my work is done remotely, so we communicate on the telephone, we use Zoom, depending what's most convenient for you as the patient. Now, if this information has been helpful, if it's given you hope, I ask you to like the video and subscribe to our channel. We put videos out every week. If you would like to work with me directly, I do take on a limited number of patients every month. I keep it small so that I could focus on each patient. I've left my clinic phone number. You can call us toll free. You can actually set up a free consultation where we can talk, find out if we're a good fit. I recommend that for those of you who are serious about getting better. Now, with that said, let me also mention that your insurance does not pay for the testing. And the testing can be expensive. It can be several $1,000s, anywhere from $500 to $2,000. So know that in advance. You can go to my website, birminghamfunctionalmedicine.com, if you'd like more information, or you can schedule a talk either by calling the toll-free number or going to www.talktodrd.com. But one thing I would say is, please don't put up with this. You can get better. Help is here. The only thing you have to do is reach out and ask. So God bless you. I hope that I can talk with you one-on-one in the future. You have a great day.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.